The aortic regurgitation can be primary, which in that case the aortic cusps have a certain disease, such as degenerative bicuspid or tricuspid aortic regurgitation. Those findings are most common in well-developed countries, and in low-developed countries we tend to see rheumatic endocarditis, which can be an etiology for aortic regurgitation. Infectious endocarditis can also be a different cause of aortic regurgitation, and the secondary causes can be the aortic root dilatation or aneurysm, which might lead to aortic regurgitation, and the ascending aorta aneurysm can lead to aortic regurgitation as well. Aortic dissection can be another cause of aortic regurgitation, and trauma can be additional etiology. So we tend to use certain diagnostic tools for aortic regurgitation. One of those tools can be the echocardiography, which we use we see the qualitative criteria such as the valve morphology, abnormal flail, large coaptation defect can be qualitative criteria. Continuous wave jet can be dense. We can have regurgitant jets, which can be very large central, or we can have eccentric jets of variable size. And also we can have holodiastolic flow reversal from the disecting aorta, which can be higher than 20 centimeters per second. The semi-qualitative criteria can be the vena contracta, which can be higher than 6 millimeters, and the pressure half time can be lower than 200 milliseconds. The quantitative criteria can be infective regurgitant orifice area, which can be higher or equal than 30 millimeters. The regurgitant volume can be higher or equal than 60 milliliters per beat, and we can have enlargement of the cardiac chambers, which in that case we might have dilatation of the left ventricle. Different diagnostic tools can be the cardiac magnetic resonance, which gives us information about the regurgitant fraction, and we tend to use this tool when we see that the echocardiographic criteria are discordant with the clinical findings. And the computerized tomography is the third tool that we use for precise estimation of how much the ascending aorta or the aortic root are. So we can make our own measurements through the CT scan, and we can estimate if we have an ascending aorta aneurysm or aortic root aneurysm, and if this is the reason why we have aortic regurgitation. So these were the diagnostic tools that we tend to use in order to know if we have aortic regurgitation.